Today, I'll tell you that. This whole thing started for me with the registry here of the end of life. Now, can I see a show of hands? How many people have registered end of life here? That's about half of the people. You need to be at the office Monday through Friday between 10 and 2. You can get the forms there and you can get the booklet and all the information. But it's what to do when you are approaching the end of life, what happens, what you need to do. I'm not here to talk about that. I'm here to talk about, well, I thought about that, and I thought, well, I've got the end of life covered, but what about making it to the end of life? Okay? Like, that's the concern that I had. I live alone, and so living alone, I face a lot of issues. I mean, it's not just heart issues, but I face transportation, feelings of isolation. I'm not there yet. You can tell I'm not malnutritioned, but it could happen as I get older, and I have a risk of falling. So these are some things that concern me as I live alone. The other thing that concerns me is I live in a gated community. It doesn't have an attendant at the gate. The fire department and the EMTs don't have a key to get in. And so I was faced with, how do I solve that problem? What if I'm having heart issues? Okay. The way I solved it is I have an air horn, and if it goes off, then all my neighbors know that I'm in trouble and they need to come check. Okay? But I mean, that's what you have to do. You have to analyze your situation and come up with a solution. I really want to talk about the heart issue that I face. Okay, it happened in 3 events over a period of about a month. And the first event occurred when I used to be deployed all over the United States and the territories because I was a first responder. I was a cartographer, and I helped decision makers understand what the situation was, where it was, what they needed to do. And as such, when it's in response, when a disaster occurs, you spend an awful lot of time working, like 6.5 days a week, 12 to 16-hour days, in front of a computer, sitting in a chair, about the most sedentary lifestyle that you could possibly imagine. And because I'm deployed and away from home, I'm eating out all the time, which is not a recipe for good heart health. In fact, it's horrible. So I was between deployments, and I was walking with my wife to a coffee shop, which was, I don't know, about 3/4 of a mile from home. We had done this a lot, and on the way home, I couldn't make it. I actually sat down and said, go get the car. I said, I'm just exhausted. And that's one of the first signs that I experienced that I was having a heart episode. Next incident occurred when I'm deployed to Hurricane Harvey, which was in 2017 in Texas. Again, long hours, sedentary activity, and eating in those hotels. I had another episode where I'd never experienced it before, but I thought it was just indigestion. That's what it felt like. And I thought, well, it's going to pass. And it did. It passed. Now I recognize that indigestion is a sign of warning for a heart attack. Like, it's not always grabbing your chest, you know, and doing things like they do in the movies. Sometimes it's quite different. And so the third episode was when I was being redeployed to another disaster. I was sleeping in my bed at home, and my wife woke me up and said, "Are you having a bad dream?" I said, "No." She says, "Well, you're yelling at the top of your lungs." And I said, "Well, what am I yelling?" She said, "Well, it was just kind of gibberish." I said, "Well, that's normal." No, I said, she goes, "Anything hurt?" And I said, "Yeah, my jaw hurts." And she says, "Your jaw hurts? Anything else?" I said, yeah, my left arm hurts. Yeah, I hear a lot of groans out there in the audience. You know what I'm talking about. She was a nurse, and so she saved my life. She said, get up, get dressed, we're going to the triage unit right now. We went, had a heart catheterization that night. The cardiologist came in and said that my LID was 100% blocked, okay, and my other two arteries were 90 and 70% blocked. Wow. He said, and you had two incidences that you've described to me. He said, you should be dead. He said, this is a widowmaker. He said, you're a dead man walking. And I said, well, I'm not dead, so fix it. So that's what they did, okay? Yeah, no, it's funny. Ha, ha, ha. An ambulance ride to another hospital about an hour and a half away for a quintuple bypass surgery with no heart attack. So there's no heart damage. Did I luck out or what? And so part of what Dr. Moya is my cardiologist, okay, and he has been taking care of me ever since I've been down here in Ajijic. And I know that he has a lot of information that he can give you so that you will understand the warning signals and what you can do about it, as well as other pieces of information. So I want to introduce you to him. You didn't come to hear me, you came to hear him, I'm sure. He's educated at the National University in Mexico City in cardiology. He's been practicing for 24 years, 10 years in Ajijic at the Heart Center. And his biggest accomplishment is that he's my cardiologist.
Why are they laughing?
Am I? I don't know. What is this? He has publications, and we're not going to go into all of that stuff because you don't care. What you really want to hear is you want to hear him speak. He also attends major cardiological events for continuing education. In December, he'll be going to New York City for I guess it's a worldwide conference. Yeah. So, and you know that cardiology is a CABG, the coronary artery bypass graft that I had, was developed in Buenos Aires. Okay, this is a Latin American invention. Okay, it's been perfected in Guadalajara. And guess who practices cardiology in Guadalajara as well as Ajijic? You're in good hands today. This is really a useful place for you to be. So I want to introduce Dr. Salvador Moya. Oh, these guys here are so good.
No. Thank you.
My pleasure, sir.
Good morning. Good morning.
Good morning. Buenos dias.
Buenos días. I'm Dr. Salvador Moya Villaseñor. I'm cardiologist. I'm become a doctor in the past century.
A little louder, just a little.
Better?
No.
Better?
Yes.
Good. I'm here to speak about the heart attack. As you know, heart attack is the main killer between us, all of you and me. 20% of you will die from a heart attack. So getting a heart attack is a catastrophic event. But now I am here to work with all of you because my intention with this speak is none of you getting or will have heart attack. And if you work, intentional work, you and your doctor, start today, start tomorrow, you will not get a heart attack. I'm going to teach you what is the best way. Okay?
Okay.
So, you know the President Clinton. 3 years after he leaves the government, he has the same problem as shown. All the coronary arteries blockage. Can you imagine President Clinton has the best medical care and no doctor identify the problem? So speak about coronary disease, heart attack, sometimes is difficult because many times are silent. No symptoms, no one. And even worse, the first symptom is death. It's crazy, right? So that's the reason you and me, you and your doctors has to work again intentionally with numbers. What numbers? Okay. There are risk factors to develop atherosclerosis process. The atherosclerosis process is a chronic disease. It's when your arteries in the brain and in the heart start to build up plaques, cholesterol plaques, calcium plaques. And the atherosclerosis process is accelerated by smoking tobacco, drinking too much alcohol, high blood pressure, cholesterol, bad cholesterol, diabetes, high insulin. So, if we know it, that the atherosclerosis process is accelerated by the diabetes or high blood pressure or cholesterol, so we have to focus on that. Of course, we have not to smoking tobacco. Don't not drink too much alcohol. What is it? If you have high blood pressure, you must to know it, your numbers every day, even if you are taking medication. Getting high blood pressure and taking medication is not at normal blood pressure. You must know it. And must know it, the numbers, 120/80 or less. If you have diabetes, you must to know your number about your blood glucose level or hemoglobin A1C. The hemoglobin A1C must be 6 or less. If you have cholesterol, high bad cholesterol, LDL cholesterol, you must, and you are taking medication, you must to know the numbers about your LDL cholesterol, even if you take the medications. Every day, every month, you and your doctor has to speak and take the best decision for your better future. But it's a work between you and your doctor. But heart attack even still are presenting in the population, even with normal blood pressure, normal diabetes or glucose level or hemoglobin A1C or LDL cholesterol. So there are others. Blood test, cheap blood test, you can speak with the doctor to do it. Because the atherosclerosis disease, this chronic disease, is an inflammatory disease. Low-grade inflammatory disease. It means day by day, your plaques are growing. going up, little by little, but every day, like in compound interest. You know, pathologists had been seeing plaques even in babies. So the atherosclerosis process is a very, very important process. And now we can identify who is in high risk in this inflammatory process with a cheap blood test, even with normal numbers, LDL, cholesterol, normal, glucose level normal, high blood pressure, etc. There are specifically two blood tests: lipoprotein A and apolipoprotein B, ApoB. For example, if you are with high levels of ApoB, these are 400 pesos blood test, you are in high risk to get heart attack or stroke. Even with LDL cholesterol normal and all other numbers normal. You are with ApoB levels high. You have to speak with the doctor and ask to the doctor and ask you, okay, the next step is prevent the future heart events, but also where are you now? Where is your heart and coronary arteries plaque now? So you can do a next step, doing a CT scan, and you can see your coronary arteries inside. If you have plaques 70% occlusion or beyond. If you have plaques of 70, 80, 90% occlusion, even with no symptoms, you have to speak with the doctor and ask him what is the best treatment for the narrowing now, and then has to speak with the doctor what is the best approach to prevent future heart attacks. So you can do too much about you to prevent a catastrophic event. Yours has to be intentional, has to know your numbers, even if you are taking medication. And if your numbers are okay, perfect. Third, knowing what is your inflammatory status with those blood tests. And if you are now, even with no symptoms, if you are with problems, speak with the doctor, treat it. And the last, doing a future treatment to get a very long life expectancy with a very quality of life.
I thank you very much.
My pleasure.